Good afternoon, everybody, and welcome to the next Geary Institute Tuesday seminar. Today, I'm delighted to welcome a speaker who has come to visit us before. Today, we're welcoming back Massimiliano Mascherini, who's Head of Social Policies Unit at Eurofound. He joined Eurofound in 2009 as a research manager, designing and coordinating projects on youth employment needs and their social inclusion, as well as labour market participation of women. So today, Massimiliano is going to present new research to us on the impact of the Covid-19 crisis on young people. Before he starts, can I again remind you that we take questions through the Q&A format at the end of the seminar. So without further ado, over to you, Massimiliano, and thank you.
Thanks a lot, and good afternoon, everyone. And thanks a lot for the invitation. It's a pleasure to be here at the Geary Institute, although virtually, for this presentation. I'm Massimiliano Mascherini. I'm the head of Social Policy Unit at Eurofound, which is the European Foundation for the Improvement of Living and Working Conditions. We are located in Dublin. We are in Lacklandstown, so only 8 kilometers and 800 meters from the Geary Institute. So is saying my phone actually. So thanks again for your invitation. And you may remember that in the past I presented something on needs, young people not in employment, education and training. And today I'm going to present the impact of the COVID-19 crisis on young people. So basically my presentation is organized more or less this way. I will. It is mainly based on the forthcoming report, also read with my colleague Esther, that you can see here on the cover on the slides. It will be published in November 2021, and I'm going to discuss this morning on how we measure the socioeconomic impact of the COVID-19 crisis in Europe. I will describe then the impact of on youth employment, the surge of telework, which is one of the main changes that the crisis brought. I will focus on the implications of telework, and so I will discuss the case of young women with children during the COVID-19 crisis. I will briefly talk about the impact on education, and then I will move to one of the most major impact of the crisis on youth, that was on mental health. And finally, last but not least, I will conclude on a few slides on trust, optimism, and vaccination. So this is what I will discuss in the next 40 minutes. So I will just start. So the COVID-19 crisis. This is how we see it, actually, like a modern Kerberos, the three-headed hound, a guardian of the hate of the Greek mythology. Kerberos had three heads, like these three faces of the crisis: an health crisis, an economic, and a social crisis. In fact, the COVID-19 exploded in March 2020 as an health crisis, but shortly after, actually, it became an economic and a social crisis due to the non-pharmaceutical intervention put in place by governments in order to control the virus, actually. And then it was clear also that the COVID pandemic, after the first weeks, it was clear that the COVID-19 pandemic was here to stay, actually. It was not just a short crisis. So basically, like a modern Kerberos, these three crises, health, economic, and social, affected the various demographic groups of our society in a very different way. The COVID-19 disease and the coronavirus deaths actually were age-specific, and this has been clear since the beginning of the pandemic, that older people was more likely to suffer the fatal implications of the disease. But then younger generations, and especially women, were much more exposed than the older population to the wider consequences of the restrictive measures, actually. So the lockdown, the closure of shops, the social distance. And so we had these three crises that were hitting different parts of the population. In order to study the COVID-19 crisis in Europe, we launched in March 2020 the COVID-19 survey. And this is one slide of one of our advertisements, actually. The Eurofound survey on living, working, and COVID-19 was launched in March 2020. We were, and we have been actually, the first European agency, European institutions to launch a pan-European survey in order to understand the implications of the crisis among Europeans. Honestly, we thought to do just one round, actually, just the first wave, because we were all hoping that in a couple of months, the situation would have returned as it was before. This was not the case. We already carried out 3 rounds of the survey. We had more than 150,000 participants. And we also have, you can find all the data on our website. So a little bit more in detail regarding this survey. This is the share of respondents. Basically, in the first wave in April 2020, we have 68,000 respondents. Then the participation went a little bit down during summer 2020. But then in March 2021, when we had our 3rd round, we still got almost 50,000 respondents, actually. Now, we are planning the 4th and the 5th wave. The 4th wave, it will be launched now in the next week, actually, and it will be only panel, because our survey has also a panel component that allow to follow the same respondent across time. And then in spring 2022, we will have the final round, as we hope that the pandemic for that moment would be just gone. It is a survey, so it's pretty different from the other and usual surveys that Eurofound produce, like the European Working Conditions Survey and the European Quality of Life Survey, that are based on face-to-face interview. It's an e-survey, so it's based on convenience and snowball sampling, results are post-weighted in order to reflect the socioeconomic structure of European societies. If you are interested in the data, on our website, you can find aggregated data of all the questions and you can play with that. Or if you are interested for research purposes, you can write me and we can grant access to microdata on the basis of a confidentiality agreement. Now, what was the results of these surveys, actually? The key findings were basically drafting and depicting a bloom picture of Europe. We found that Europe was hit hard by the COVID-19 crisis, and high levels of loneliness and depressions and very low levels of optimism were recorded among the population across this time. There were, especially in the first part of the pandemic, a deep concern about financial labor market futures of the individuals, but we also recorded a positive effect of the support measures that were put in place in order to support the citizens. However, a larger share of respondents claimed to have lost their job, with a dramatic decrease in working time for many, although then telework actually helped in this. However, it put a strain on workers with children, especially during times where schools were closed. And finally, the question of trust in institutions, which decreased a lot since the start of the pandemic, and basically put some question marks over the stability of some of trust in some member states. So this is what we saw in general and in 5 bullet points. However, if you move to youth and COVID, what we found was that youth are more resilient to the COVID-19 disease than other age cohorts. The journal Nature actually published that in June 2020 that if 1,000 people age older than 75 would got the COVID-19 virus, around 116 would die for it, whereas this share is very marginal for those who are actually younger. However, despite being more resilient to the disease, young people, we found that young people were more vulnerable to the economic and social implications of the restrictive measures put in place to control the COVID. So they are more vulnerable to the economic and social implication of the COVID-19 crisis. Here, in which dimensions actually, the dimension of employment, of education, of social capital, but also on mental health. We will see all these in my presentation, and we will start actually from employment. Last time that I came at the Geary Institute, actually, I discussed the concept of needs, actually, and the trends of youth employment and unemployment during the crisis, and as a result of the 2008-2013 double dip crisis. Now, before the pandemic started, young people were in a much better situation in terms of labor market. As we can see from the graph on the right, actually, that described the unemployment rate from 2007 to 2020, actually, we could see that in 2019, finally, the shock of the Great Recession was reabsorbed with youth unemployment that reached at European level the same level of before the pandemic. In this period, the needs rate decreased from 16% to 12% of the entire European young people population. But what was important was that the composition of needs changed. If in 2013, the characteristic of needs actually were more of a long-term unemployment and with some threats of disengagement, the population of needs in 2019 actually was mainly focused on people with short-term unemployment as well as in family responsibility. So basically, situation was much more rosy in January 2020. And then the crisis arrived actually, and what we recorded was that, as recorded by Eurostat, actually not by us, that the need rate increased considerably in 2020 as a result of the COVID pandemic. It jumped from 10.7% to 12.1% for young men. And again, we had a 1% increase for women. So it increased again, actually. So there were a concern that immediately started few months after the start of the COVID-19 pandemic. Is the history repeating itself? So will young people also the victim of this crisis, actually? Well, the evidence is mixed, actually, but for sure, young people are those who were more likely to lose their job in the first part of the pandemic in comparison to those aged 30 years or older. According to our survey, 11-12% of young people in summer 2020 lost their job in comparison to the 8% of older workers. And older means aged under 30 in this case. They felt more uncertainty regarding their job in comparison to older age cohorts. So they revealed an additional vulnerability in terms of labor market structure, in terms of labor market participation. The explanation actually is in some sense quite simple, and it happens for two reasons. First one, because they were young people was overrepresented in sectors that were most affected by the pandemic. Differently from the previous crisis, this crisis was totally exogenous, actually. So it didn't depend to economic reasons, actually, but to an exogenous agent that was the virus, and the measures put in place in order to defend the entire population from this exogenous agent. And these hit basically certain sectors. So it became a sectorial crisis with retail, accommodation, travel, arts and entertainment that were the sectors that were badly hit by the lockdown and the social distances. And these, unfortunately, were the sectors where young people are overrepresented, where they work more, as we can see in the graph on the right of the screen. But then also because young people are more often working in a less secure type of contract. Most of them, I mean, many young people work with the temporary contracts, and these temporary contracts were easier to terminate, are usually easier to terminate during the crisis. So for this combination of the two, we expected and we saw an increase of youth unemployment. Now, if we go to see our data, this basically is a Sankey diagram on employment status transition of young people during the pandemic across the 3 points in times that we have investigated. So basically spring and summer 2020 and the summer 2021. So if we focus and we can see the transition of the different status, these are the same individuals monitored in 3 points in times. Of course, it's a restricted number of observation, but what we can see is basically that the cohort in unemployment increased in this time. It was basically before the pandemic, it was 3.6%. It increased then to 4.9 to 8.7, and then in March 2021, it reduced a bit to 7%. But again, it indicates an increase in unemployment. And what we saw in general was that in the entire sample that we investigated, 12% actually lost their job during the pandemic. This was highest in Mediterranean countries as well as in Ireland. Younger age class, 18 to 24, had a significantly higher probability of job loss, but with no significant differences in gender and in education. So it was kind of phenomena that really was a sectorial, and for those working in these sectors, skills didn't really provide a defense. However, if you then look at the cross-sectional data, and are those in the table on the left, and this is the result of the questions: have you lost your job since the start of the pandemic? We can see here how young people was more affected by the crisis in terms of the occupation. In spring 2021, 17% of young people claim to have lost their job since the beginning of the pandemic, and notwithstanding it, they found another one, but they have lost their original job before the pandemic, against the 9% of the older age cohort. So these confirmed the additional vulnerability of young people in terms of labor market participation, also during this crisis. Now, what happened during the pandemic is that, of course, some sectors shut down overnight. This was dramatic for the economy, but this is what happened. On the other hand, other sectors went online, went working from home, went in telework. And so what we see actually that in April 2020, so in spring 2020, 2 months after the start of the pandemic, 50% of Europeans were, almost 50% of Europeans were working from home. And this was a dramatic change actually, because this share was much reduced actually before the pandemic. And teleworking has become the customary mode of working for many employees during the COVID-19 pandemic. And depending from member state to member states, this still continues to be actually. Or we are now moving towards hybrid form of labor market participation, from home and from the office premises. But this was huge. 50% of people were working from home. And especially was massive because basically in Europe, 65% of European population never worked from home before the pandemic. So it was a huge change, a dramatic change, but that allowed to work basically in many cases actually. So it was a huge change with see these 65% of Europeans that never telework before and suddenly started to telework. And I would say with a great degree of satisfaction, because in summer 2020, 55% of those who are teleworking said that they were happy they were happy about their telework experience. And here, Ireland is just above the European average, and almost 60% of Irish people that was working from home claimed that they were satisfied of this experience. And in fact, if we go a little bit deeper, we ask what will happen. I mean, if there were no restrictions due to COVID-19, would you really like? Would you like to keep working from home? Actually, and the result said that the majority of the workers said yes, and this share is the highest among young people. 75% of young people would like to work from home daily, several times a week, or several times a month when the pandemic is gone. So it is a huge share, and you can see that it then decline for older age cohorts actually. So it is a huge share that indicates probably a transformation of the concept of work, where we are going to move towards an hybrid form of work, where we'll alternate period in office with a period at home actually. And in this, young people seems to be those who are more happy to have this hybridization of the labor market. Now, these are good, but it is had strong implications during the pandemic, and it will have some implications also afterwards, but especially during the pandemic. And the implications were for young women, because with the closure of schools, young women with young children were working from home, and they had to take care of family responsibilities. So these allow us to highlight a possible victim of the crisis, that are basically young women. This because for two reasons, actually. First, like young people, also women in general, they are overrepresented in sectors that were mostly affected by the closures and the lockdowns. So for this, in the first part of the crisis, and it's important to highlight, in the first part of the crisis, young women were hit hardest in terms of labor market participation in comparison to men. But then, with the closure of schools, actually, those who remain at work and had to combine work and family life, and had young children, with the closure of schools, actually, this made their work-life balance explode, basically. And at the end, were the mothers with the small children often bearing the brunt of the impact of the COVID-19 crisis. This is mainly for one reason, for the uneven allocation of family responsibilities within families. Just let me show two slides on this. The first one is the work-life balance of men and women with young children. Blue are men with young children, and orange are women. Please focus on the top two indicators that are basically hard to concentrate on job because of family, and the family prevents giving time for job. So here we investigate the role of family as an obstacle for the job, and you can see here that women are 3 times more likely to indicate that it's hard to concentrate on job because of family, and almost 4 times more likely to indicate that family prevents giving time for job, because they were alone, or anyway, they had a major weight on their shoulders in order to take care of their children as well as working. And this was unsustainable for many women. This is even more clear if we look at the time spent for children care and family care. So here also we asked how many hours per week were men and women caring for children and grandchildren outside the paid work. In spring 2021, 51 hours were dedicated by women with young children to take care of their children against 29 hours of men. In spring 2020, it was 65 hours for women. So it was huge. And there's a huge difference between men and women. The same is, but less evident, is for cooking and doing housework. So these actually tell us that necessary steps are needed in order to bring to a cultural shift and to a more fair allocation of family responsibilities within families, because this brought really some women to withdraw from the labor market as soon as the schools were closed. So it is quite important that this is addressed. There are different situations in different member states, but this is a general problem actually that refer to most of the member states. Now, this is due from the closure of schools actually. So what we can say on the impact on education of the COVID-19 crisis. Very briefly, actually, we know that lockdown meant the closure of schools in many countries. These had a direct impact on young people and their human capital accumulation. Scientific literature actually correlates quite clearly school attendance with the two things, actually. One is skills accumulation, and the other one is the social networking, the having social contacts. There are clear publications that indicate that the more those who have a higher attendance are usually those that have a higher marking in the exams, actually. And then another thing that was less evident, but it will become evident then in the future, is the exacerbation of inequalities. Now, schools were closed, and so young pupils had to keep their educational trajectory within their families. Now, here the difference between the most privileged and the less privileged became more evident in two ways. Having parents with high-level education, with tertiary education, granted a much robust, or anyway possibly higher level of support from parents to pupils in terms of skills transmissions, actually, because they were more. It was probably more possible to support children in their school homeworks and lectures, and then also because for the different level of equipment, because most privileged had easy access to computer, iPads, and especially to a reliable internet connection, things that the most vulnerable not always had. And this is a source of as food for thought, because it could have fostered these inequalities between privileged and the less and more vulnerable. Now, how did it go, the online schooling, actually? According to our survey, almost 55% of European students went on studying online during the first wave of the COVID-19 pandemic. So we are talking about spring 2020. Half of them received materials or instruction to self-study online or for download. Only 4 out of 10 actually during that period received individual feedback from their lectures. So a very different educational experience. How students reacted. 35% said that they were satisfied with online learning. And if you think it was 65% those workers that were happy and satisfied about working from home, actually studying from home, didn't receive the same level of success, actually, also because we saw that 75% of young people would like to do more online working after the pandemic. Only 2 out of 10 students would like to do more online schooling after the pandemic. So it's a very different picture here on the adaptation to study from home in comparison to working from home. Now, the impact on you on mental health, actually. Switching a bit subject, actually, but is linked with the closure of schools, as we will see in the next slide. The impact on mental health of the COVID-19 was massive. We can say that beside causing diseases and deaths, the COVID-19 pandemic also generated a parallel epidemic of mental health, whose effect actually could linger long after the pandemic has subsided. Basically, implications for mental health were of the nature of two types. The first one was a pandemic-related distress that could have stemmed from the fear of the illness, the economic hardship, and the uncertainty about the real impact of the crisis and about their own situation. And the second one is the result of social isolation, tensions, lockdown that are the direct result of restrictions that most governments deployed in order to contain the pandemic. Now, I will show you a few indicators about that. This is the WHO mental well-being scale. We know that it goes from 0 to 100. Is based on a few indicators, and we know especially that if it is below 50 in an individual, it indicates risk of depression. Here we had that the average at the country level was below 50. So in spring 2020 at the European level, the WHO mental well-being scale was 49. It increased to 53 during the summer 2020, when we believed that the COVID was just been gone. In spring 2021, it decreased even further. It reached 45 as a form of evidence how tired was the population of lockdowns, of the COVID, of all the restrictions. To have a direct comparison, in the European Quality of Life Survey, which is our usual survey, we recorded that was a 64, the European average, in terms of average WHO 5 mental well-being index. In literature, we can see that these indices, the change in these indices at the aggregated level is very slow. And here we had just a collapse and went to 49. If we go to other aspects, on the other hand, that investigate negative aspects in terms of mental well-being, we can see that these rates skyrocketed. So, for example, feeling of downhearted and depressed, it was 6% in 2016. It reached 25% in the first wave of the pandemic. So 1/4 of the European population felt downhearted and depressed. It reached then 31% in spring 2021 during the third wave of the pandemic. Exactly the same numbers, more or less, are recorded for the feeling of loneliness. In spring 2021, when several countries undergone another lockdown, 1/3 of European population felt lonely. Again, it was a 6%, 1 out of 15, instead of 1 out of 3 before the pandemic. The same thing is for feeling of tension. Almost 40% of Europeans felt tense in spring 2021 against the 11% before the pandemic. Now, this has not hit all the population at the same time. We said that two may be the reason. One is the fear of the disease, actually, and the fear of possibly die for the COVID, or the implications of lockdown and social distances. These slides actually shows that probably was not the fear of the pandemic. And we will see also this in another slide, because not everyone was affected in the same way. And if we see these three indicators of tension, loneliness, and depression, we see that those that were mostly hit by depression and loneliness and tension were young people, but especially young women. And in general, these three indicators are in much better shape for older people, higher than it was before the pandemic, but much less higher, around 20% less higher, 20% lower than for young people. And if you go a little bit more in detail, here is still an analysis based on our panel data. And we saw that, okay, young people have been mostly among the mostly affected by the COVID-19 crisis, actually, in terms of mental well-being and mental health. What we saw is that it changed from the different moment in time. So in summer, it was a higher level of mental well-being in comparison than March and spring 2020. There were no differences in terms of gender in this case. Men and women suffered the crisis in terms of mental health in the same way, more or less, according to our model. Unemployed and students suffered the crisis in terms of mental well-being more strongly than those in the labor market. Having a tertiary education, and especially having a partner, helped a lot in order to have a higher level of mental well-being. There is some geographical distribution, but it is important to focus then also on the non-pharmaceutical intervention and their impact on mental well-being. According to what we saw with our data, school closing had a detrimental effect on mental well-being of young people. Workplace closing, on the other hand, had a positive effect on mental well-being. Staying at home, we didn't find a significant effect, but not even had a significant effect the number of COVID deaths that were recorded. So it seems that this negative effect was mainly driven by non-pharmaceutical intervention. It is important also to reflect on one thing. I said a lot that in terms of mental well-being, the young people has suffered the COVID-19 crisis in terms of mental well-being much more than older people. This was not the case before the COVID-19 pandemic. I mean, if we look at our previous European Quality of Life survey, but especially to scientific literature, we see that young people usually have a higher mental well-being than older age groups. And so this was quite a strong impact of the pandemic in reverting things. Then, again, I wanted to reflect a bit, then I'm going to conclude with the last item on trust, on the case of women with children. These are the three indicators of tension, loneliness, and depression for people with children, no children, and children that are not young. What we can see is that the blue column is the one of people with children, is that young women has the higher level on feeling tension, 23%, against the 90% of men with children. Again, 14% of young women with young children has felt depressed during the crisis against the 9% of men. And again, actually, it is interesting, the feeling of loneliness. Because if you have a child and you are locked down at home, you don't expect to feel lonely. And in fact, only the 6% of men with young children declare to have felt lonely, actually. But this is not the case for women. 14% of women with young children claim to be felt lonely. So this has to be also to make us reflect on probably how they felt lonely. And why? Maybe because they were alone now, taking care of all these, and they felt actually this feeling of loneliness on the basis of the additional responsibilities that were on their shoulders. Now, I wanted to close with a few slides on trust, optimism, and vaccination. Despite this gloomy picture, actually, young people are still more optimistic than all the other age groups. 53% of young people in spring 2020 were again optimistic about their own future, again the 42% of other cohorts. Young people still has a higher trust in institutions than other age cohorts. Trust in county government was an average of 5 out of 10 against 4.6 for other cohorts, but especially young people has a higher level of trust in the European Union. 6.1 was the average grade, the average mark that they gave, against the 4.9 out of 10 of other cohorts. This is a data. Is confirmed in all the different waves, although with, of course, some oscillation that should made reflect the policymakers, because this is an incredible amount of human capital and of trust that young people has, especially in the European Union. And so it is very important that there is an incredible amount of social capital is not wasted, but that policies are put in place in order to support young people during the crisis, but especially during the recovery, in order to avoid that the same damages that happened in the 2008-2013 crisis are repeated. Finally, vaccination. This is the share of vaccination in Europe, and actually Ireland was the less vaccine hesitant country with a willingness to be vaccinated that was around 90%. Young people are less hesitant than the rest of the population, and this is on average in Europe, but in most of the member states. If we analyze the vaccine hesitance in Europe, we see that the share of vaccine hesitant is lower than among young people than from the other age categories. Unemployed are those that are more vaccine hesitant than the rest of the population, as well as those affected by illness or disability. Students are much less vaccine hesitant than the rest of the population. One thing that drives vaccine hesitance is social media. It's not really how much use is done by the social media. So the intensity, it's not the intensity of use of social media, but it's the purpose. If social media are used as main source of news, this is the main driver of vaccine hesitancy. And this is consistent in all the member states, and also by analyzing it with usual and multivariate model. Now, those who do not vaccinate, actually the reasons of vaccine hesitancy are basically not trust in the safety of vaccine, worried about the health issue, but also the risk of COVID is exaggerated and the COVID-19 does not exist. These are the shares for all the population. If we investigate this for young people, we saw that young people are slightly overrepresented among those that indicates that the risk of COVID-19 is exaggerated, and this can be understandable as they are less vulnerable to the COVID-19, but also among those that think that COVID-19 does not exist. So finally, I started with Kerberos, the three-headed hound, the guardian of the hate, and I wanted to conclude with Heracles, the Greek hero that defeated Kerberos. How he did it? He didn't face, or he didn't fight ahead at once. Actually, he just fought the three heads together by taking taking Kerberos for his throat. And this, if we wanted to move to the metaphor, we need an holistic approach, actually, or we needed a holistic approach that took into account not just the health implications, but also the economic and social implications, especially with the tools that have to be put in place during the pandemic in order to smooth the economic and the social cost of this pandemic on younger cohorts and women. The European Commission has moved something on that. It has launched the reinforced youth guarantee that will allow young people to easily access to the youth guarantee and to green and digital skills. But it's important that all the member states actually act in order to avoid that the history will repeat itself and the social capital of young people is not squandered and lost. So thanks a lot for your attention, and if there are questions, I'm here.